High infant mortality is a big determinant of a country's level of socio-economic development. Uganda's efforts to achieve the goals of Vision 2040 would be dealt a big blow if not much is done to reduce infant mortality. Uganda's infant mortality stands at 90 deaths per 100,000 live births. Pneumonia is now the leading cause of death among children below 5 years, taking the place of malaria, which has been the leading child killer for decades.
The universal net distribution campaign that took place a year and a half ago, we're beginning to see malaria prevalence go down.
When germs enter the lungs, they overpower the immune system, replicate and get embedded in delicate lung tissues. In 2015, pneumonia claimed 922,000 children under 5 around the world. This means at least 2,500 children died every day, or over 100 every hour. Every year, Uganda loses between 18,000 to 20,000 babies due to pneumonia.
Because pneumonia begins just by a cough. Usually it's a simple cough and maybe a fever. And if you don't get treatment, it can progress to become pneumonia. So in a number of cases, the parents delay. But also
Dr. Robert Opoka, a consultant pediatrician and the head of the acute ward in Mulago National Referral Hospital, says the ward receives over 200 emergencies weekly and 50 come with pneumonia cases. At least 5 of these die.
When you get inflammation, you get swelling, you get pain, you get accumulation of fluid in the lung, that is lung congestion, and that is what causes the symptoms that make them come to hospital.
This is the Mulago Children's Ward, known as Ward 16. From the acute ward where they are given emergency treatment, they are referred here on Ward 16, and here they will stay for at least 2 weeks. The numbers are overwhelming, with the patients and parents on tension because many of the youngsters have severe pneumonia. Nalongo Topista has been here for over 10 days. Her 4-month-old twins came in with pneumonia. One of them is still battling the disease.
She was breathing badly. She forced herself to breathe, difficult in breathing.
Early detection is very important in managing pneumonia.
If a child starts to sneeze, to cough, to have difficulty in breathing, consider that potentially severe and take to the hospital so the health worker can assess and do the needful.
Some of the early signs and symptoms of pneumonia include
cough, difficulty in breathing, high fever. That is what they come in with, and they look very sick and they require treatment urgently.
The Malaria Consortium has introduced timers which were given to the village health teams for easy monitoring, but these now need improvement. They were intended to monitor the pulse and the child rate of breathing for quick referral.
And one of the key challenges was the timer that was available makes noise. Ticks the seconds or the minute with the seconds. So by the time it reaches 1 minute, it has done 60 seconds. That tends to distract the community health worker. We are working on a project to look at a whole range of other timers.
A pneumococcal vaccine was recently introduced in the country.
Because the vaccine is given to children who are less than 2 years, and so the number of children who were already there before the vaccine came, and so those are still prone to the pneumonia. But hopefully the ones that are being vaccinated now should be having less pneumonia. But there are also other causes of pneumonia. So normally what happens is when you vaccinate against one, then the other organisms which are not vaccinated against can also begin to cause pneumonia.
Exclusive breastfeeding for the first 6 months of life is an effective way to protect children from pneumonia and other infectious diseases. In addition, good nutrition for older children, hand washing, clean water, good sanitation, clean indoor air pollution, free from cook stoves and tobacco smoke can also help protect children from pneumonia. To improve the management of children with pneumonia, especially in rural areas, there is an urgent need for new diagnostic tools to help in the detection of the symptoms. Irene Namialo, NTV.